me get this one. Get me a little more center on that one. Here we go. Without turning the whole thing. Yeah. Turn it. Boom. And then bring me down on everything. So I'm going to be talking about it right here. Yep, keep going down. What's up, everybody? Juliana, you're the first one to join us. Welcome. All right. YouTube, Instagram, TikTok. We are all here. We're going live, and excuse me if I'm not looking exactly at you for each one because I'm talking to all three of you at the same time. Whichever platform you're on, give me the most interactions so you could be the winners, okay? Get some free Botox. I'm just kidding. I don't know. I don't know how to get that to you. I don't know how to figure that out. But anyway, we love your comments, feedbacks, questions. I'm going to get to them at the end of everything I'm going to talk about. It's not going to be that much today. It's National Botox Day. I'm just going to talk about some basics, some Botox basics. And a little bit of filler basics. I've got this cool little model here, and you know, hopefully you guys will be able to learn a little bit from this and take home some kind of preventative type of stuff that could help you figure out if you'd like to make some beauty decisions in regards to injectables. All right, Dr. Barrett, I'm a board certified plastic surgeon. I do a lot of facial injectables, everything from skincare to injectables to facial plastic surgery to body surgery, everything you name it. I even care about wellness and health because I actually think that has a lot more to do with our appearance than we give it credit. So sleep, diet, gut health, all those things are really important. But when it comes down to some heavy hitters of improving facial appearance, Botox by far is one of the best ways to increase your youthfulness. There's actually a twin study that was done on identical twins. One twin had Botox for like 10 years, and actually 20 years, and the other twin didn't. And you can see there's a marked difference in just same location, everything else, same upbringing, non-smoker, all that stuff, how improved the person who got Botox, their face was, versus the twin who got Botox, who didn't get Botox. So it's a pretty powerful effect. We know that Botox works by relaxing muscles of dynamic motion, and that's what causes wrinkles. Like, I'm totally Botox free right now. I'm due for mine, so I'm gonna have to pay on my nurse injector to get it. You can see this is my forehead lines. They're starting to stay, all right? And then down here, one of the things I've actually been doing is I've been doing NAD IV drips and injections, and it's actually greatly improved my skin quality. So I've been able to stretch out my Botox sessions. There's also a supplement you can take called NMN, which you can get on Amazon, NMN. Read David Sinclair's book. I think it's called Lifespan. Okay, and he talks about the importance of NAD, and then there are some studies that are talking about NAD in terms of like long COVID, getting rid of long COVID. I think I might have had long COVID. I'm not sure, and so I did a bunch of NAD IV drips, and it cleared that up. But then I also noticed my skin and my hair was like, whoa, it's like, whoa, it's like looking great. And it was like, your skin looks awesome. And I'm like, yeah, and I'm like, I don't even have Botox on, so it was cool. But the only problem is those NAD drips are kind of hard. They're expensive. Botox isn't quite nearly as expensive. So let's, I digress. So let's dive into Botox and how it works, why it works, what a typical cost is, okay? So Botox, again, works by relaxing muscles of dynamic, that cause dynamic wrinkles. Dynamic wrinkles are like here, here, okay, here. There's the top three. There's also some down here, like the depressor angularis oris, bunny lines, which are in here. Some people have that. And you can also do a lip flip with Botox or reduce your masseter muscle. If you really bite down and if you clench your jaw at nighttime, you can get Botox there. Botox also works for sweating. If you have really sweaty armpits and it's a cold day, but you're still sweating through your armpits, you get about 50 units in each armpit, and that actually helps reduce sweating. It also has a lot of other things you can do. There's a lot of therapeutic uses for Botox, but we're just talking about cosmetic use. It, by the way, can actually help with migraines. So you might be able to kill two birds with one stone with your Botox when you get it for your face. Okay, and the good news about that is sometimes insurance can cover the Botox for migraines, all right? But some other uses for like Raynaud's disease, if you ever get the really cold fingers, if you go out in the cold exposure, it's called Raynaud's. You can actually Botox the little arteries at the base of your fingers, and it relaxes them so you don't get that vasospasm in the cold. And that's really important because a lot of people can get ulcers on their fingers with really bad Raynaud's disease, okay? So let's talk about the top three, okay? I've got my little dry erase marker, or I did, and I lost it. So the top three are, oh, here we go. This is pretty big. It's a red one. What happened to the blue one?
I don't know.
Did I sit on it? I think that's, it's under here? Here it is. Found it. This is a red one. We'll use that for different things. We'll use that for muscles. How about that? Okay, so I'm going to draw out, we've got low battery on the YouTube, but we're okay. We've got 10% left. Okay, So the muscles, let's talk about the corrugators, all right? This area is one of my favorite areas because if you Botox this area, you kind of get a little bit of a brow lift. You actually look and feel happier. This is true, okay? They did a study on Botox in this brow area, that people who got Botox in this area had a 50%, actually, I'm not sure if it's 50%, but they had a less incidence of depression. Powerful, right? Like Botox, wrinkles go away, you're less depressed. We don't quite know how it works. We think it's a feedback mechanism where you're not able to frown and your body's like, oh, you must be happier. Or other people think you're happier and they're like more positive with you, right? So kind of like what you get, what you give. But let's draw those muscles out, okay? So there's corrugator muscle here, and then there's a procerus, okay? So this one goes up and down. That's why when we actually inject this muscle, it raises the ball. And these are like little tadpoles. They're bigger over here and here. So we want to inject Botox here, here, and here. And that's going to stop all those wrinkles, those 11s that you get when you furrow your brow. But it takes a little while. If they're really deep, it might take a little while for that to go away. But by far, that's probably, if you do no other Botox, start with that area first. This is the beginning area. Everybody's going to be happy. Obviously, go to a qualified person. Come to see me. I'd love to see you. And that's that area. Now, the next muscle is for the forehead lines. Now, this area is a lot trickier. Like, look how far this muscle goes out. And the tricky thing is where you see the wrinkles isn't necessarily where the muscle is. So you get a lot of inexperienced injectors that will inject where they see the wrinkles, but then it doesn't actually fix the problem. You need to know the anatomy, okay? This is why I went to medical school for 37 years, okay? So I know, just kidding, it wasn't that long, all right? We gotta know the anatomy of these muscles. This frontalis is very different. There's actually no muscle for the majority of people in the middle right here. So you'll see some inexperienced injectors, they'll put an injection right there. Big mistake, there's no muscle there, right? So you're just wasting your Botox. But we do know one thing about Botox is that when you do inject it, independent of the relaxation of the muscle, actually increases the collagen production of the skin. So that's kind of important too, because that's separate from relaxing muscle. That's causing wrinkles. So it's doing something we don't quite understand. All right, so for over here, I typically do like I'm gonna use a different pen for this, and so I typically do a series of injections down low, and I go out laterally. If you don't go out laterally, a lot of people don't go out laterally, and they get this little Spock effect. So it's like you get motion on the side like that, which is really annoying. It happens to me sometimes because some people aren't used to my muscle being really strong right here. Maybe because I raise my eyebrow, people. Anyway, now we do the top portion up here and top portion up here to get those widow peaks. And if you have some men that have a receding hairline, you want to make sure you get that spot up there as well. So that's the forehead. Now the other area that's a crowd favorite is these lines here. Does anybody know what those are called? Anybody tell me what those lines are called? All right. Botox works for TMJ. Yes, Alexis, it does. But this is not TMJ. This is crow's feet. All right, crow's feet down here. And there is these are the wrinkles, but the actual muscle is a circular muscle that goes around the eye. It's called the orbicularis oculi, and it goes all the way around here. But where we want it, it's like a rubber band, okay? So a rubber band that goes around the eye, and it causes these lines over here. Where we want to inject is here. I'm going to do it with the blue again. I want to inject here to give a brow lift at the same time. We'll do the brow lift here, a little bit here for the lines. A lot of people try to sneak it under here. I occasionally do that, but I don't recommend it because it can kind of make this look weird down here. And you got to stay away from over here. So some inexperienced people will inject too far down low, and then guess what goes away? Your smile. Okay, so every people see people that have great flat face Botox and like, hey, so great to see you, and their face is like this. It's probably because they went too far down here and they got their zygomaticus major, right? So those are like the top three, very successful, almost always routinely does really well. Now, the other areas that we can actually do Botox are the nasalis muscle here, which causes bunny lines in some people. Okay, so right here and here. And then you can also do the upper lip. The upper lip can result in lip flip and can help get rid of the smoker's line. So if you're constantly purring your lips, smoking cigarettes, let's stop smoking cigarettes, all right? I'm sure you probably heard about that, how bad that is for you. But also straws and things like that, you know, you want to try to avoid doing that. But you can get Botox here. I use anywhere from 2 to 4 units, and then I inject you know, a couple here and here and here. And you can also do it on the lower lip again. You got to be careful if you overdo this. If you're not experienced, you're gonna really cause problems with people's speech, ability to eat, so on and so forth. Okay. So Bethany, thanks for the cowboy hat. Appreciate you. All right. So now The depressor angularis oris, this is another one. If you have a sad face, you're going around, you're getting older, and it's pulling down all the time. This muscle down here, DAO, depressor angularis oris, you put 4 units down there, and it can lighten that area up and turn your frown into a smile, literally. So people that know they have it, they're like, let's go around, everybody says I have a resting bitch face. Inject that area, takes care of it. So those are pretty much the main areas for Botox. You can actually do it for a little eyelid twitching. Oh, I forgot about the masseter in the jaw, the TMJ. You guys asked about TMJ, all right? Let me tell you about that. It doesn't work for everybody, but the big muscle over here called the masseter muscle. You probably see it better on my jaw, all right down here. You inject about 20 units on per side, and it works. It lasts for about 6 months. For some reason, it lasts longer, and it helps decrease grinding your teeth, and it helps slim up your face if you want that, okay? That, I think, is pretty much it for Botox. Some people can kind of do a little bit here to prevent a plunging nose. When they smile, their nose goes down, a plunging tip. And now we're going to move on to filler, all right? So can you guys, we're going to wash that mannequin face off. And I have a syringe of filler. I lost all my markers. You got this. Or just maybe move them to here. All right, I have a syringe of filler that I'm going to inject for you guys. Should I inject my own face or should I inject the mannequin? All right, you tell me. It's probably better if I do it on the mannequin because I really don't want filler today. This is kind of left over from before. So filler is different. Filler actually fills in volume loss. Like, see, I have a little volume loss, and I have a little volume loss here. As we get older, we lose middle cheek compartment here. You can also do rhinoplasty with it. You can do lips. Lips is very common. It's a very popular area to do. So basically, filler is volume, and we're going to add it to the certain area, okay? So if you look right here, you'll see the way I like to do lips is I inject from the corner, and I use the numbing medicine to go in, okay? Now I'm going to drop this filler in here so you can see it's not really that much, right? Can everybody see that? Oops, you can't see that. Here we go, right? We go here, we stay in the vermilion. You know, one of the things that really bugs me is when people come from the top and they try to inject from the, let me just clean that off a little bit. They try to inject from the top, and that's really painful because when you come from the outer portion, it's from the white portion of your skin is very painful. But if done naturally, you know, you can actually really plump up the lips. And I have a whole website called Natural Looking Lips. Put a little filler here. This is a common area. And then I actually do the filter columns from underneath, and then do a little bit in the middle, and then plump up the bottom of the lip. Okay, so I'm really into natural looking lips. Other common areas is the nasolabial line, right? Put that there. See that, everybody? That's cool. That goes away. But we also don't want to forget the under eyes and the cheeks. Okay, so the cheeks I use a different product. This is a hyaluronic acid based product. I use calcium hydroxyapatite, and then which is thicker, lasts for like 2 years. And then we have the temporal area. Okay. Now some more advanced areas are the nose. Okay, we can do dorsum. We can do tip of the nose. Tip is really hard, but can be done for certain people if you want a rhinoplasty. And then we could do this A-frame deformity on some people when they get really old, their eyes get hollowed out, we want to fill in the eye, okay? So these are some of the common areas that we use for filler. There's a lot of different products that could be used for all of these areas. And of course, this is just a small amount of filler, but this is actually what it looks like. It's this tiny little gel that goes in for the most part for hyaluronic acid-based filler. But if we want the more heavy-duty filler, it's called calcium hydroxyapatite. It's a higher lift factor and it's pretty cool. Okay. So one thing to remember when you're going in to get these injections, there is a chance to bleed, right? So we want to avoid anything that might cause you to bleed. Any blood thinners, aspirins, Advil. Drinking alcohol the night before or right before your appointment is not recommended. It will cause bleeding and so forth. We can go ahead and back this up because we'll chat and we'll start answering questions maybe just about a foot. All right, so that's it. My recommendation, if you're thinking about getting Botox or filler, come see me, go to a board certified plastic surgeon, start with some Botox first, see how you like it, work your way up. How long does it last? Well, generally Botox lasts anywhere from 3 to 4 months for most of these movement areas. It can last longer for the jaw, like 6 months. And yes, you can actually do Botox for a gummy smile. Someone just asked me a question about that. Right up here in this area. So if like a really gummy smile, it can actually help bring that down a tiny bit. I know that is inconvenient for some people, and I just almost slipped off my operating room table. And how often do I have to keep on my Botox? So Vicky Douglas, yes, how often do I have to keep my Botox? I say it's anywhere from 3 to 6 months depending on your goals. If you want to be completely frozen all the time, it's every 3 months. If you want your wrinkles to come back and then just stop them from becoming permanent, like mine are starting to get lines in when I'm not making the movement, that's around 6 months for me, so I do it every 6 months or so. Of course, you can always stop Botox and or any neuromodulator, and your skin just kind of goes back to what it used to be. And yes, there are other products. There's Xeomin, there's Dysport, Botox. There's slight differences in the molecules, a little bit different. I've noticed that Dysport kind of diffuses a little bit more. I got to be careful where I put it because you can get more of a droopy eye. With Dysport, it hasn't happened to me, but you know that can happen, so you just got to be careful with it. Dysport doesn't last quite as long as Botox, but we're talking probably just a few days difference. And Xeomin, I haven't really worked with it very much, but I've heard good things. So pretty much all of them work pretty good. I think you would just want to make sure that you go and talk to your provider about it. Yes, so Christina 3, yes, preventative Botox for 20-something-year-olds. I do agree with preventative Botox. I feel like if you really start in your 20s and in your 30s, getting some Botox here and there, a little bit of filler here and there, and really good skincare and really good health and wellness things, you can really preserve the appearance of your skin, okay? So that when you're 50, you don't need a facelift, and instead maybe 70, okay? So I really mean that. There's a lot of treatments that we're doing now, minimally invasive, radiofrequency, skin tightening, microneedling, all these little maintenance things, they really make a difference. Facials, depending on the type of treatment, are really great. Two big things you want to look for in your skincare are retinol and vitamin C. Those have been like scientifically proven to actually increase the collagen in your skin. And then of course sunscreen if you're out in the sun a lot. I don't think that you should completely avoid the sun all the time, but your face, you should really protect your face the most and limit your sun to just a little bit every day. Don't be in direct sunlight for like 6 hours, right? That's a big problem. All right, so let's answer any questions. Aging neck, yes, a halfie. Neck lift is great, certainly a good option. I have a no scar neck lift. I'm actually working on the website because it's really cool. We have a combination procedure with CO2 laser and Renuvion, so we can actually tighten it. So like say you're in your 30s, 40s, maybe in your 50s, and you want a neck lift. We actually offer this where we just tighten up the neck without having to make the big scars like the facelift incision. Neck lift is also great, works really well, but if you don't want all that downtime, check out, well, just shoot us a DM about a no scar neck lift because our website's not ready yet. I'm working on it, but it's a great way. My crow's feet are terrible. I look 65 and I'm 30. Help. What do you recommend? Crow's feet by far. Botox, number one. Get those muscles under control. Next thing is skincare. Last thing is resurfacing. CO2 laser or microneedling of some sort. Microneedling with PRP or exosomes. That's kind of the newer thing that's going on right now. I actually had exosomes for an IV therapy. And I was like, I felt like I was on steroids for like 2 weeks. It was great. I was just trying to test it out to see if we wanted to offer it for our patients. But I think it helped my skin. I think it helped everything else. Helped me kind of recover from some like colds that my kids got me and everything else, which seems like half of my battle these days is recovering from the illnesses that my kids give me, both mentally and physically. So what is the best product for chest wrinkles and sleeping on the bedside? You know, they say you should sleep on your back. You want to try to avoid this kind of side sleeping position, which is true for wrinkles, but I don't know if it's best thing for posture and everything else. Chest, décolleté area, sun exposure, got to avoid the sun exposure. You can do sculpture injections. I dilute sculpture or Radiesse to inject into that area. My favorite is to do fat grafting. The reason why I like fat grafting is because we take fat from here, has adipose-derived stem cells, and we inject it into the chest or even the neck area in a dilute manner. And those stem cells kind of incorporate into the skin, help rejuvenate that décolleté area, and then you got to do peels or laser to resurface as well, okay? I've never heard about the nose tip impact on Botox. This helps with noses that droop, gentle when smiling. Yes, Christina, it can. Again, this is one of those things. Lower face Botox, not reliable. Upper face Botox, very reliable. So sometimes if you have a plunging tip, you know, when you smile, try a little Botox here or even in here to see if it works for you. I mean, we're talking like 6 units. It's not very much. But if that's a problem, you can check it out. I'm anemic right now. Should I wait until my hemoglobin is normal before any procedures peels? You know, anemia doesn't really affect a peel, but if you're going to think about any major procedures that might have bleeding, then definitely wait. But you should be getting on top of that. Eat some have some things with iron in it that should help with your anemia, okay? How often should you change out implants? We're switching subjects, but that's generally, I recommend about 10 years. How much does Botox or fillers cost? That's great. So it's anywhere from about $8 a unit to about $16 a unit, depending on where you go. I'm on the higher end of that. I've got all this fancy rent to pay and this knowledge to impart on you for a fee. But you get some great bedside manner and some great results. But that's generally how much you're looking to pay per unit. A typical area is about 20 units, okay? And then some people charge based on the area. But just, my recommendation is find the best person and get a good relationship with them and see if you mesh well with them and you have a good feeling about them. Do we do payment plans? Yes, we do. I really want implants, but I'm worried about BII. Daniel Rubin, that is another topic to talk about, breast implant illness. It is real, but it's much lower than we think. No scar revision after dog bite, laser, depends. You got to send us, you guys want to send us your questions at our virtual consultation page, okay? Go to Dr. Daniel Barrett, check out virtual consultation, and fill out the information there. We'll get back to you. Let's see if we can help you. The other thing is if you're on my TikTok, check out my Instagram, Dr. Daniel Barrett. I get back to DMs a lot. So Dr. Daniel Barrett, Instagram. And if you're on my Instagram, check out my TikTok because I got some crazy stuff on there too. It's called Barrett Plastic Surgery. And then lastly, if you want really in-depth, awesome information, check out my YouTube, Dr. Barrett Plastic Surgery. I think we're trying to change that name, or we talked about it. Anyway, Dr. Barrett Plastic Surgery YouTube. We got all these cool videos. We filmed a lot today using this little mannequin and filler. So we're gonna have that. I just touched a bunch of hyaluronic acid. This feels great. Yeah, in case you want to know, this is a syringe you're going to waste anyway. I didn't just like blow a syringe on a mannequin for no good reason. How much does breast augmentation cost? Shoot us an email. You guys we'll get back to you. Info Barrett Plastic Surgery, or you can just go to our virtual consultation page. And let's see, bunny lines. Is it safe to get Botox in the bunny lines? Yes, it is. That's that tiny little nasalis muscle. So if you do this little like bunny, right? You could get a little Botox there. And it helps it out. All right, we're going to answer one or two more questions, and then we're going to sign off. Let's see what we got here. Oh yeah, if you guys want to check out more, if you want more information, make sure you follow us so that you can kind of get this stuff. Especially subscribe on my YouTube. That's like where you're going to get all the good videos. Can you drink alcohol after Botox treatment? Yes, you can, but I would wait 24 hours. I'm not a big fan of alcohol. I used to drink a lot when I was younger, and I just realized that it's really bad for your skin. So I drink occasionally, but it's everything in moderation, right? Are there options for improving the area under the eyes besides filler? Yes, that's a good question. There's a trifecta of things you need to do for the under eye area. So filler is one. Reducing the skin pigmentation is two, so skin care. And then tightening the collagen in the skin. So resurfacing either laser or microneedling helps thicken that dermis. Why is that important? Because look at the back of your hand. Can you see the blue vein there? Well, that's because my skin is really thin. So if you don't want to see the blueness underneath your eye, which can be dark circles, you have to thicken and rejuvenate the skin underneath your eyes. And that's the best way that I know is through microneedling or CO2 laser. So those are the three things to help improve the under eye area. That's it for live today, you guys. We're going to try to go live again next week to get this going again. And again, if you have questions, just DM me on Instagram. Dr. Daniel Barrett is my handle. Thank you so much.